Hello, my name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery Informational Webinar. Before we begin, we want to make sure everyone knows who this webinar is for. Today's webinar is for new and continuing applicants of the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery program. The program provides grant opportunities that will result in funding organizations to educate and train providers in these professions to work in underserved communities. On an additional note, we will have a separate application for licensed midwifery programs coming up October 24th. So be watching our website and your email for the webinar registration. Here's today's agenda. I'm going to do some housekeeping and the introduction. Then I will be introducing Castanina Naval, our Song Brown program officer, to give us updates, application process, and requirements. And then we'll have a time for question and answer at the end. And here are those housekeeping items to talk about. Number one, our webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number three, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. The slide deck and resource links are posted in the chat right now. You can access those. And with that, it's my pleasure to introduce Castanina Naval, Song Brown Program Officer.
Thank you, Chris. Good afternoon, everyone. My name is Cassidy, and I'm the Program Officer for FNP, PA, and CNM. Before we begin, let's talk a little bit about Song Brown. So we do fund education programs for FNP, PA, registered nurse education programs, primary care residency programs, certified nurse midwifery training programs, and new this year, the licensed midwifery training program. We award programs who graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine, and locate programs, main training sites in medically underserved areas, serving majority of patients who are Medi-Cal recipients. So the application date, so the application opened a week ago. Early submission review deadline is October 29th at 3 p.m. This will give you an opportunity to send in your application. We will review it, provide some feedback for you before October 29th. Any application that is submitted after October 29th is considered final, and the final due date for this application is November 12th at 3 p.m. So just remember 3 p.m. and those 3 dates there, and you're golden. So before you apply, here's some information that you're going to need to know. If you have an authorizing body at your institution that approves grant applications, please make sure that they are aware of the terms and conditions contained in our grant agreement. Make sure you review the terms and conditions before receiving your funds, as you will need to approve and agree to those terms and conditions before the award will be given. Funding shall be used to expand primary care services and shall not supplant existing federal, state, or local funds to provide primary care. Some changes to the 2024 FNP, PA, and CNM application cycle. So there are changes to all criteria across all 3 applications. I will get into that in more detail at the very end of the presentation during the scoring and methodology explanation at the end. Student race and ethnicity will now be collected in student aggregate only. And we are limiting the number of training sites that we are asking for. So 5 maximum, and I'll get more into that in the training site section of this presentation. We are also asking for the organizational NPI number for each of your 5 training sites. Some information to gather prior to applying. Your grant agreement and pay data record signatory. Make sure they are authorized signatories for your grant. Something I really want to emphasize on this page is the importance of getting your W-9 IRS forms to fill out your application. So we want to make sure that your organization name and your doing business as name is accurate to what is listed in your tax forms, as well as the address that you will have all of your payments remitted to. Make sure you have that, gather it from whoever in your institution has access to that W-9 form, as it will delay payments if that information is incorrect and needs to be corrected after you're awarded the grant. Names and addresses of all of your training sites, along with the cumulative hours used for the previous academic year. And as long as they are primary care sites within the state of California, they can be used as a training site. And then the facility type for each of the training sites you select to input in the training sites of the application. So for students, the only thing we need to collect this cycle is race and ethnicity for all of your current students, first, second, and third year. Your current practice site for your graduates, as well as the graduate NPI number, will also be asked. And as for required documents for FNP programs, the approval letter from the BRN for PA programs, it is the ARC PA letter, the accreditation letter from ARC-PA, and then for CNM, the accreditation from the ACME. And if you are expanding for CNM, you require the letter that approves the number of approved slots. So as long as the number is listed for the expansion slots that you requested is on there, that is going to be required for an expansion CNM program. Some helpful resources on our website is the guides for FNP and PA and CNM, as well as the TA guide for all three. You can find all of those resources on the Song Brown website, so please check that out under the FNPPA and Midwifery sections in the Song Brown website. Along with those grant guides and TA guides is the Song Brown glossary. If there's any terms that you need clarification on, the Song Brown glossary will have those terms for you, also in the resource section of our website. Some helpful tips navigating the application. So your two buttons that you will see at the bottom of every page is your previous and save next buttons. Previous helps you navigate backwards in the application if you need to correct something or you need to reference something. Previous is the button that you're going to use. And every time you complete or you need to save that section of the application, you would select Save and Next. The Save and Next button also makes sure that the application is saved and you can refer back to it if you did not complete it. You will access your applications in the Grant Applications tab in the funding portal under the link to the program you are applying for. So FNPPA, you will select Song Brown, Family Nurse Practitioner, and Physician Assistant tab in the Grant Applications tab. Your grant preparers will also be accessing your initiated applications there, as program directors are the only ones who are allowed to initiate an application. Some more useful tips here. So the red asterisk next to a field will tell you that it is a required field. So this right here, this red dot at the top of each field, that says that it is required. Right next to that, some fields will also have this blue circle with a question mark. That is a tooltip just providing you some more information on what we're asking for and what you need to input in that field. So this is the walkthrough for the FNP, PA, and CNM application. This is a page-by-page, step-by-step walkthrough of the application. This is exactly how the application will look when you apply. There are some differences for CNM, and we'll get to that in the end, and I'll point them out to you as well as we go through. So the first page you're going to see is the program information page. I want to emphasize that this top part here will be auto-populated from your profile page. So if you see anything wrong with that section, all you will have to do is go exit the application, go to your profile page and edit what you need to edit, and then come back into the application, and that should be corrected for you there. The next section here is going to be you selecting if you're an FNP or a PA program. In CNM, you'll see later that is a different question in place of this here. So you'll select the program you're applying for. Following is the training program title. If you are a returning applicant, you will select this magnifying glass here, and that will pull up a list of all the previous training programs that have applied with us before. If you still do not see your training program name in that list, you will select training program not listed here, and that will allow you to enter your training program information in this section. Next is the contract administration page. This is the one where I want to reiterate that we want you to have your W-9 IRS forms present when filling out this section. We are during the early submission review, we will be checking this page very thoroughly, because if anything is wrong with this page and it does not match your IRS forms, it could delay your payment if you were to be awarded. So make sure to access those IRS forms. Make sure to have them handy to input the correct organization name and doing business name if needed, as well as the remit to address that you will enter at the very end of this page. The other thing you're going to be entering here is your contract admin. They are the main administrator for your grant, so make sure that information is correct here. And the next thing on this that we can see from this screenshot is your grant agreement signatory. They must be an authorized signatory for your institution for grant agreements. Still on the contract administration page, if your SCD 204 signatory is the same as your grant agreement signatory, you can select yes, and you will not need to enter any information about that, because we know that your SCD 204 signatory is the same. But if you do need to enter one, make sure that their email, the first and last name, is spelled accurately, as they will be receiving their grant agreements to sign via DocuSign if you were to be awarded for the grant. And the last thing here is going to be the remit to address for all of your payments if you were to be awarded. Make sure, again, I will reiterate, W-9 IRS forms, whatever it says there, please enter it here. If you do have a different address that your payments need to go to, you can select yes here, and you can enter a different address, as long as the first one is what is on your forms. So the next page will be the program description page. This is where you get to tell us about your program and how they align with Song Brown's mission, and a little bit about your program's successes and whatnot. You have a maximum of 2,500 characters for this section. If you were to copy and paste from Word to here, just make sure that you do have 2,500 characters. You will get a pop-up that says you have reached the maximum character limit, so you may need to edit or delete as needed. But you do have 2,500 to give us some descriptions of your program. Program data will be the next page. If you have 22-23 and or 21-22 graduates, you will be selecting student and graduate data, this option here. If you do not have any graduates for 22-23 and 21-22, you will be selecting the student data only option right there. From there, you will be telling us when you enrolled your first set of cohorts, what year that was for your first admitted students. So this is our training site page. Like I said earlier, we are limiting the number of training sites that you have to give us to 5 primary care training sites with the most cumulative training hours for all of your students in the previous academic year, so 23-24 academic year. To add sites, you will select add a site here. If you need to edit or delete a site, you will select the arrow button for a drop-down where you can edit or delete a site. Once you select add a site, you will get a pop-up window where you can enter the information for your training sites. You will enter the training site name, if it is a private practitioner. And then, like I said, we will be asking for your facility type. For more information on facility types, we have a more information link right at the bottom here where the arrow is pointing for you to click and have more information. Each facility type also has one of those tooltips to give you some more information on what these facility types are and if those training sites in particular are applicable to that facility type. You can click more than one if the training site is applicable to more than one. We ask the number of cumulative hours for all students who trained at that site here, and the organizational training NPI number for that training site. If you do not know offhand, that is okay. We've also linked the NPI registry website right next to it. So if you need to look up the training site and find their NPI number, it is linked directly on the website for you. And the last thing on this pop-up will be the payer mix for the training site. So program directors, you can ask your the training site coordinators or the training site themselves, what is the payer mix for their site? So we know Medi-Cal, Medicare, combined, or uninsured. All right, so this is the program expenditures page. Here you'll be telling us the number of slots you are requesting. This number will be multiplied by 13,000, and that will give us the total funds you are requesting for your application. Below, you're going to input your expenditures from last academic year, 23 to 24. That is personnel, operating expenses, major equipment, and other costs. That will total out here. And this number, the total number here should be greater than or equal to this number here. So that is that for FNP and PA. There is a slight difference. This is one of the pages for CNM, and I'll get into that in a bit. This is the new aggregate student data page. You will enter all of your student data information here. We are not requesting names for this cycle. So all you need to know is the capacity of student enrollment, how many students applied, how many students were admitted, the total number of enrolled first years, second years, and third years. That will give you a total here. And that total will have to match the total at the end of the aggregate collection of race and ethnicity. It will tell you if it is not the same, and you can fix accordingly. This is our graduate page. Here you'll have to enter the number of graduates for 21, 22, and 22, 23. And that is the number of graduates we need to enter here in the added graduate section. We are not allowing import this year, so everything will have to be inputted manually, but you have to just add a graduate here. And same with training sites, there's a drop down if you need to edit or delete a graduate. And then we'll go into that pop-up here. So this is what the pop-up looks like. You will enter your graduate name, first and last name at the top. This screenshot is showing the information we are asking for other than their name. Excuse me. You will need the graduate's NPI number here. This is for the graduate and not their practice site. Here you will add their practice specialty. You'll let us know what it is. And then the next one is if you know the practice site. If your graduate is practicing in the state of California and you know that practice site information, you will select yes and then provide us with their practice site name and information. If you do not know your graduate's practice site or they are practicing out of state, you will select no and tell us whether they are practicing out of state or is other or unknown reasons. The second to last page in your application will be the required documents page. This is where you will be uploading those accreditation or approval letters to your application. So this red box means that this is the only required document that you need to upload. You need to upload all of your documents with the title of the page of the document being APPR_. That's how our program will accept the document. If it does not have APPR, this button will never turn green because it is not accepting the document. So once this red button turns green here, that means your pages are uploaded and good to go. This correspondence section here is not required. If you do have correspondence that you want us to know about, you can enter it there as long as they have the prefix CORR_, it will be accepted by the system. Then the last page of the application is the assurance page. You will read the statement above, and once you are ready to submit, you will select I certify. Once you submit the application, unless we are doing early submission review and we allow you to resubmit your application after review, this will be final. So make sure that all of your information is accurate once you select I certify and submit, because you cannot go back in and edit after you submit. So you'll read this, click I certify, and press submit when you are ready. All right, so as I said, there are some differences to the CNM application to the FNP. The order is the same, it's just some pages have a little more information that is required. So for CNM, if your program is expanding for the 25-26 academic year, you will select yes at this button on this section. There will be two fields that you will need to read and check off to make sure that you are indeed expanding and it does fit the parameters of our expansion program requirements. And then same with FNPPA, you'll find your training program. So that's the same. It's just that expansion piece is a little different. The next thing that is different is the program expenditures and funding page. Here, you're going to select the total slots requested for your existing slots, and then your total slots for expanding slots, up to 3. So you can have up to 3 expansion slots for this cycle. That will auto-calculate here on this side, and same with FNPPA. The total down here for previous academic year expenditures must be greater than or equal to this number up here. Now we'll get into the scoring for all 3 of the programs. So this is the scoring criteria, the points, and the page of which they apply to in the application. So criteria 1 is the percent of graduates in areas of unmet need for 25 points. You can find this criteria will be captured from the graduate data page. Percent of students in underrepresented medicine is 25 points. That information will be gathered from the aggregate student data page. And criteria 3 will be the percent of main training sites in areas of unmet need for 25 points, and the average pair mix of training students up to 5 sites with the most cumulative hours will also be 25 points in the training site page. So those are your 4 main scored training, 4 main scored pages: your graduate data page, your aggregate student data page, your training sites, and your training site page. Those are your 4 main ones. So here is an example of a program and how they are scored. So criteria 1, percent of graduates in areas of unmet need. The program has 50 graduates, 20 of which are practicing in areas of unmet need. The percent is 40% of their graduates are practicing in areas of unmet need. We will multiply that 40% by 25, the total number, the number of points possible, and that will equal 10 points for this criteria. Percent of students in underrepresented medicine, they have 60 students. They have 30 students in underrepresented medicine. 50% of those students in underrepresented medicine multiplied by 25, and they will receive 12.5 points towards their overall score. Next is the percent of main training sites in areas of unmet need. They will have 4 training sites. 3 of those training sites are in areas of unmet need, giving them 75% of training sites in areas of unmet need and 18.75 points toward their final score. And the last scored criteria here is the average pair mix of main training sites. So we will get all 5 or however many training sites you input out of 5 and average their total percentages here. That total percentage will be divided by the number of training sites provided, multiplied by 25. So for this particular program, they had an average of 64%. 0.64 times 25 is 16 points, giving this program a total of 57.25 points out of 100.
All right, thank you so much, Castany. As you can see, our team has been putting a lot of hard work into this program. We're excited that you've joined us today to learn more. We're going to transition to our question and answer session. Chat option should be open now and is accessible in the menu bar at the top of your screen. We do understand that some of you may not be able to access the chat feature in the browser version of Teams due to your organization's restrictions. We do find that some people have success with the mobile version of Teams accessing the chat. If you're still unable to access the chat feature, please email your questions to songbrown@hci.ca.gov, and we will answer them there. Thank you for your understanding with that. And we will answer our questions in the order that they're received, and we'll do our best to answer all the questions that you have. And so let's go ahead and go to the chat and see what questions you guys have today. Tracy asks, for the number of students applied equals, that is the total number for all cohorts currently enrolled.
Thank you for your question. So there will be 3 questions asked on the aggregate student data page. The first one is the total capacity of students. So how many students can you have in your program total, encompassing all years? The second question is the total number of students that applied to your program. So let's say your capacity is 300 and you had 600 students apply. That is what it is. So whether they were accepted, admitted, or not, you will list the number of students that applied to your program. And the last question there is the total number of students enrolled. That would be the total number of students who were selected and admitted. That's for all years together. I saw your second question pop up right at the end. Yes, that is for all years combined. And then for the breakdown for the enrolled first year, second year, third year, that's where you'll break down the 3 enrolled years. So it'll tell us first year, second year, and third year. Thank you.
All right. Thank you, Tracy, for the question and Cassidy for the answer. Next question comes from Arwa. The question is this program to be applied after I'm accepted to the PA program?
Good question. So this grant is for organization. So this is for the actual institution or program, not for students. Is that what you're asking? Are you a student applying for or trying to apply? Clarification. So I answer your question correctly. Okay, yes, so this grant is for the organization. So it is for institution grants. So if you wanted to add anything onto that answer as well.
Were you asking Melissa? Sorry, I missed that.
Yeah, that's okay. I think if I'm correct, I answered your question, Arwa. Perfect.
All right. And the next question. So for this, we would have to wait until graduated and licensed. I have a feeling this is the same situation here.
Yes, I think so. So yeah, it would be for organizations only. Yes, reiterating what I said previously for students, this will also just be for organizations and not graduates.
So for those students wondering what they would be eligible for, the best thing to do would be to go to our eligibility checker tool, and we can put a link to that, and you can see what programs you are eligible for HCAI, or you can look at our website and look at scholarships and loan repayment programs for students. All right, so we are going to focus on the organizational grant side of things. And so next question, let's see. How is the scoring for graduates practiced in areas of unmet calculated, given that for some grads, we don't know where they are practicing? And then in parentheses, non-responders.
So for that one, we will base it off of your graduates training sites. We will look at the geographical area of where their trainings or their practice sites are. For those you don't know, unfortunately, we will not be able to score the folks that you don't know. You would enter them and say other or unknown if you don't know their practice site. But for the ones you do know, please enter as much as you can for the graduates that you know where they are practicing for if they graduated 21, 22 or 22, 23. So we can give you as many points as we can with that.
All right, thank you. Next question. I want to verify that for a 4-year doctoral program, we need to include the total number of students for all 4 years.
I will have to defer to Melissa. Melissa, do you have an answer for this question?
Yes, it would be yes. You'll want to enter all of your students. when we ask for all of your students, if you're a 4-year program, we need the information for all 4 years, the student information for all 4 years.
All right, very good. Thank you, Melissa. For those that are students still on the webinar, I did post in the chat the link to the eligibility checker. So we recommend you go check that out and see what you're eligible for. All right, let's continue on. Let's see. In your training site scoring example, they only entered 3 sites, but I'm assuming that you would have to enter 5 sites otherwise. Statistically, if you have a 100% site and only enter 1 training site and score really high.
So we are working on making sure that kind of evens out. So you can enter 5, but the minimum is 1. So we don't require all 5. You want to enter 5 training sites for maximal information for us. But it is possible that some people will only enter 3, but we will calculate that accordingly.
All right, next question. If we have more than 5 sites with primary care placements, we are required to report top 5 by the number of hours, right? Not just the ones in MUAs?
Yes. So you will select your primary care sites, primary care training sites that have the most cumulative hours of training for all your students. So if your 5 sites have 600, 700 hours, you want to enter the ones with the most in primary care in the state.
All right, thank you. Let's keep those questions coming. Just as a reminder, you can, if you scroll up in the chat area, you can see the links that we've posted for you. Link to the website, the grant guides, and the technical assistance guide, as well as the email to contact us, songbrown@hci.ca.gov. In addition, I did put repost that eligibility checker for students. All right, next question. Again, why would someone want to enter more than 1 site? Because it will lower their percentage, thus reducing their score for that section.
Question. So it would be like averaged. So like there's no advantage to entering just 1 site. If that makes sense. Like, so if you only enter 1 site, you're really only getting scored for 1 program or for 1 training site. So the more training program or training sites you have, your score will improve based on that. We will kind of calculate that accordingly based comparing it to the other applications. So your applications will be so the example was just to show how the numbers are calculated, and then there's more like the back end of it when comparing applications and selecting awardees. The example that was provided in the slideshow is just to show the math of how we would calculate that in the simplest terms.
All right. Linda asks, if we are limited to 5 sites, how do we account for other students at other smaller sites in the MUAs? And then Melissa, I see that you have your hand raised too.
Yeah, so I guess I just want to add that, if I understand what I think it's Tracy, I believe, that said, why would somebody want to enter more than 1 site then? And that there's always the possibility that somebody could do that, right? They're going to pick their best site or what they think is their best site and only give us that information. But I just want to let you know that that the office itself, as we're reviewing these applications, we do have we are able to check some of this information that applicants provide. So, and if at any point we feel like somebody is not providing all of the information that we're requesting, they're trying to maybe get around the scoring, right? That's could be cause for not allowing, ineligibility. We could deny your application if we find out that somebody is doing those types of things. So I just want to make everybody aware of that. Thank you.
All right, thank you, Melissa. We'll go back to Linda's question. If we are limited to 5 sites, how do we account for other students at other smaller sites in MUAs?
Oops.
So that's a great question. And we did think about it when we were deciding to limit the number to 5 training sites. Because it is an organizational grant, we are just seeing how many of your training sites are in underrepresented areas or areas of unmet need. So you want to select the training sites that are primary care in areas of unmet need with the highest number of training of students in those areas. So if that makes sense. So you want to select your 5 training sites that have the most cumulative hours in areas of unmet need. So unfortunately, we won't be able to account for the smaller sites with a lesser amount of hours, but we want to make sure that you select the sites that have a lot of hours and impact areas of unmet need, because that is the mission of the Song Brown Grant for FNP, PA, and CNM.
All right, other questions out there?
Looks like Tracy has her hand up.
Okay, let me. All right, Tracy, you're able to unmute.
You. This was a lot faster than trying to type really fast. So I guess I need clarification because what Kanitsa just said is different than what's in there. So what's in the guidelines is to list your top 5 with the greatest number of student hours in your top 5 sites. She just added in the response to Linda's question in the areas of unmet need. So is it the top 5 of student hours, or is it the top 5 of student hours in areas of unmet need? Those are 2 different things.
They are.
So which is the right answer?
So it is the top 5 sites with the most cumulative hours. We will determine if the sites, through our review, we can tell if the sites are in areas of unmet need and you will be scored accordingly. But you, as the applicant, are supposed to provide the top 5 sites with the most cumulative hours.
Okay, thank you.
You're welcome.
All right, thank you for that question. Let's see here. Next question is from Terry. Are the numbers of hours at the training sites reported, or are we just ranking the 5 sites?
You will be listing the hours, the total hours for all students at that training site.
Elena asks, does your definition of primary care include general pediatrics?
Yes, it does.
All right. And let's see, we'll keep the line open. We've got plenty of time this afternoon to answer all your questions. So if you do have other questions or points of needing clarification, this is a great time to get that while we have everybody together. Just a reminder, we are recording this webinar, and we also had one this morning, also recorded. We will be posting both of those webinars to our webpage within 7 to 10 business days. You'll be able to access those as well. All right, give everybody another minute or so to think of any questions that you might have. Did want to ask if there's any other people having trouble accessing the chat menu. We can, if you can raise your hand and if you have a question, and we can do it that way as well if you're not able to access the chat feature. All right, Linda asks, we're a smaller program and do not have large training sites that take multiple students. For example, a large university system. How can we score higher with a smaller number of students at individual sites?
I don't really, I mean, I understand your question, but I guess I'm struggling to how to respond to that. We are a smaller, do I have large training sites that take multiple students? Again, you know, you're going to have to answer the questions to the best of your ability. As we review, you know, if you happen to be an early submitter and we come across, you know, we are looking at your page to make sure that you've provided all the information that we've asked for, and we see the low numbers, we may reach out to you and ask for clarification. But again, you're just going to have to answer the questions to the best of your ability. That's really all I can say.
All right, thank you. Yeah, it sounds like taking advantage of that early submission opportunity is going to be your best bet to maximize your score.
Right.
Make sure that you don't leave points on the table needlessly. All right. Cassidy, you have something else to add?
Yes.
Yeah.
I just want to emphasize, because of that, I do want to emphasize the early submission deadline. So please submit your early submissions. If you want your applications to be reviewed and provided some feedback, please submit your applications before October 29th at 3 p.m. We will give you feedback as soon as possible, and you have until the deadline to resubmit that. Anything submitted to us after October 29th at 3 p.m. is considered final, and we will not be reviewing until our final review.
Great reminder, Cassidy. Thank you. One more clarification for Linda. To clarify, a training site is an individual clinic and not a health agency?
Not necessarily. Training sites could be, they could be all kinds of different things, right? What do you mean by, when you say health agency, what do you mean? Oh, you mean a large agency like Dignity that covers multiple locations. Yeah, you wouldn't be able to just put in Dignity Health Center and because we know oftentimes that there's training that's happening at different different clinics within Dignity, right? So you're going to have to give us the name of a particular clinic within the Dignity Health Center system that your students trained at.
All right, thank you for that clarification. Next question. Last time I submitted this grant back in 2011, we had to also present our request in person in Sacramento after the initial application submission. Is this still the case?
No. You and you really haven't submitted in a while. Those presentations before the California Healthcare Workforce Commission, those ended a good at least probably 6 or 7 years ago. So no, we are no longer doing that. Your application is based clearly on the data that is provided in it and nothing else.
All right. Well, it's good to see you back in the Song Brown
welcome back
program. That's I'm glad to have you back. All right. Any other questions? Again, we want to maximize the value for you guys. Make sure that any questions or confusions that you have get answered. And we really value this time in making sure we provide as much information as possible for your successful application. Terry asks, is there a narrative requirement or just the data you previewed today?
So the narrative portion of this would be the program description page that will give us a kind of summary of your program, and you can insert, accomplishments that you've done with your program and things that align with the Song Brown mission. If you want more information on that, you can go to our website. Our mission's on there, mission statement and stuff. That will kind of help you write that narrative piece of this application. So that is the only narrative piece that we're asking for this app.
All right, great question. Thank you. Again, if anybody is unable to access the chat, just go ahead and raise your hand, and we can call on you that way as well.
And while we're waiting for questions, I do want to kind of highlight our technical assistant guide and all of the grant guides that we listed in our resources. All of those will be accessible on the Song Brown website. During your application, if you want to pull up those resources, it'll be really helpful to kind of have them on hand. It might answer questions quicker for you than reaching out to us sometimes. But it's there. It's available for you on the Song Brown website now. If you just look under Family Nurse Practitioner or the midwifery sections, you can access those grant guides and technical assistant guides on there.
And again, all those links can be found in the chat if you scroll up or click on there's a pinned link at the top of the chat as well, which should be you should be able to click on. So, all right. Well, give just a couple more seconds here for any questions. If you do find that you forgot the question or have one pop up, you can always email us at songbrown@hci.ca.gov. And looks like that might be all the questions for today. So thank you for your participation with us in that Q&A session. Again, we really want to make sure you guys have the resources to be successful in your application. So that's why we host these webinars. And as a reminder, we will post the recordings of this webinar and the webinar this morning on our website within 7 to 10 business days. Melissa, did you have one more thing to say before we move on?
Nope.
Oh, okay.
Thank you, everyone, for attending. But no, I don't have anything else to provide. Okay. Thank you.
All right. I thought I heard somebody pop on, but well, we'll keep rolling to the close here. We do appreciate everybody joining us to learn more about Song Brown, Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery. We're excited to be able to offer this as one part of our health workforce development efforts at HCAI, and are grateful for your participation with us today. We have some resource slides for you at the end, just so you can be aware of all of the things that HCAI offers. Please follow us. Number one, please go check out our website. That's how you're going to find out about a lot of things that we offer. You can also follow us on social media through Facebook, LinkedIn, Twitter, and YouTube. And you can feel free to tag us as well. If you have great things that you're doing as a part of one of our programs, please tag us with one of these on your social media posts so we can see what you guys are doing out there. And then one of the best ways for you to stay connected with us is our newsletter. And so we would love for you to sign up for our Health Workforce, our monthly Health Workforce newsletter. You can go to this link right here and then go select the Health Workforce options within that you're interested in, and that will keep you up to date on those. And then lastly, if you do need telephone assistance, you can contact us at 916-326-3700. And again, we had mentioned songbrown@hci.ca.gov as the email that you can get a hold of us with. One last reminder, the application cycle does close November 12th at 3 p.m. Make sure you get your applications in before then. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.